against that to say CC, Camilla Cox. Do we have Camilla on the call?
No, we don't, Prosper. She's on annual leave this week, but I'm happy to give a bit of an update about this item on the agenda. That's okay, because then I do need to leave.
Thanks
so
for
the
that.
film,
Thank you.
It's a service users film. It's called Us, which is a bit of a take on that. The film itself was funded by BEH, partly by the Haringey division and partly by our EDI team. And the making of the film was supported by Tottenham Talking, which is a program that's been run now in Haringey for a few years now, managed by a BCS organisation called the Bridge Renewal Trust. It was a true collaboration. We were lucky enough to be able to find the funding and support the program and commit experiences of service users to film. The Tottenham Talking staff, their approach wouldn't have really been possible without them, because many of the service users who were part of that actively work with the Tottenham Talking team in terms of what they do and how they overcome what they're going through and the support that's in place. So just wanted to shout out to our Tottenham Talking colleagues. The film itself was initially made with a view to be a learning tool in BEH, now the partnership. But we anticipate that this has probably got more of an opportunity. So Tim Mercier, who was the filmmaker, and Camilla presented with myself in attendance, but they presented to the Joint Partnership Board last week. The film was shared in advance. It was really well received. It's a very powerful film, clearly quite raw, but it is direct feedback in terms of experiences of service users, what that journey has looked like. And in quite often, in many cases, the journey of a lifetime, because it has been over such a long period. So clearly very powerful stuff. From discussions we've had, we think there's much value in this. And actually, we've already informally talked about the potential for incorporating this into perhaps local inductions or even trust inductions in terms of what we could do with it. The film itself has been signed off at various stages to be screened and shared, so it's had a few screenings already. It will be screened at the Mental Health and Wellbeing Community Forum. That I know Chodell is going to talk to that a little bit more later, so it will be part of that partnership session at the Spurs Stadium later this month. So I'd make a suggestion that at least part of it could be viewed here as well. We normally just have to go through a process. Just to note, everybody, the full film itself is about half an hour. That's the only thing, just to note of that. But we are trying to ensure that this gets as much coverage as possible. The last thing I did just want to add was that there will be a further discussion as an output from the Joint Partnership Board meeting with Tim and Camilla and our CEO Ginger, just in terms of what the next steps could be about how we share it, what we do with it, because it is a very powerful film. And those of you who have seen it, because I know it has been shared within some forums, I'm sure you'd agree. So I bit of a background to a bit of context, and I'd take it to you, Chair, to see whether or not there would be an opportunity to screen at this forum at a future meeting. Thank you.
Great. Thank you very much for that, Gary. I really, really appreciate that, and look forward to watching this film. And great to know that this will be part of the. It will be shared at the event in Tottenham. I don't know if there's any questions around that. I think it would be helpful if there was a way to at least see this film here, maybe just 5 minutes of it. I don't know how easy it is actually. Well, if it's a 30 minutes film, but just to see some of the highlights from that film at this group, that would be great.
Thank you. Thanks, Chair. I need to leave now.
Right.
Thank you very much, everybody. Bye.
All right. Thanks for that. Cheers. Yeah, so we could say 5 minutes of this meeting at the next meeting. Would that be okay, Jodelle, to just show the key highlights? I don't know how easy it would be to do that, but I'll leave that one with you. But really great. Can I
Sorry, Chair, just to say Gary said that he'll send us the link as well.
Oh, you will send the link as well.
Yeah.
Oh, so that's fine. I think if we're getting the link of the whole film, then maybe we don't need to share it at this meeting, because I assume that everyone then will receive that. So I might have missed that point. Jadelle, do you want to then maybe, I think it sort of fits in very well to talk about the Tottenham event at this stage, and then we'll go back to our priorities. If you could just talk about the Tottenham event, that'd be great.
Great, thank you. So we're hosting the partnership in collaboration with a community organisation called Black Equity Organisation. We are hosting a mental health and wellbeing community forum at Tottenham Stadium. And this event was the brainchild of a project team made up of 4 experts by experience that I've had the pleasure of working with. It was initially from a programme by NHS England aimed at tackling health inequalities, and we were successful in bidding to become part of that project, and we were allocated some money to work with a project team with experts by experience to progress a quality improvement type approach to tackling health inequalities. And so from speaking with the experts by experience in the project team, the golden thread in all of their stories was that had they known what was out there earlier on in their mental health challenges or crises, their outcomes could have been very different. They, knowing things such as, where to find the crisis number, or that there's even a crisis line number, knowing about early intervention teams, just knowing what information of services are out there, that could have been vital for shortening their time and improving their experiences. I do have to say that, they have had some great experiences, as not local to our trust, as with any mental health trust, there are things we can improve on, and that's great, but there are also things that worked really well. And one of the overarching strong voices is their commitment to wanting people to seek help earlier to ensure that they maintain that control over their mental health and well-being and get the help they need in a timely fashion. So yeah, as I said, it's a partnership event, so all of the boroughs and divisions are part of it, and we are very grateful for this, and I think it's going to be a great event, and there's lots of excitement around it already. It also ties in with the launch of the National Patient and Carer Race Equality Framework, the Advancing Mental Health Equality Strategy, and also our objectives within our Equality, Diversity and Inclusion team. So the event, we've got a provisional schedule of events that I'm happy to share just very quickly. But yeah, we would like to open the event by speaking about the things that we're doing across our divisions to tackle health inequalities, speaking about things such as, the Dialogue Plus, the implementation of Dialogue Plus, something that is going to be replacing previous care planning tool. And again, that gives service users a lot more autonomy in, the areas of focus that they really want to see achieved. Sometimes it might be medication, it looks at relationships, it looks at, their aims for work. So again, lots of great things. And it's also a really lovely way of getting service users actively involved in their care, but people still don't know about it at the moment, so we'll be using the event to talk about that. And then there'll also be a section at the beginning where Samina and I will open up and talk about our State of Inequalities report. So again, highlighting the health inequalities that we found in doing the report, and touching on the action plan and what we're going to do to progress things, because again, communicating with our residents, our service user population and the wider community about what we're doing to advance our work on health inequalities is also vital, and feedback that we receive time and time again, not local just to us, but people want to know what's going on and how they can become actively involved. So there'll be a bit of a breakout session for PCREF. Again, we want to get people involved in generating ideas, what their priorities will be, and that co-production is a key part of the Patient and Carer Race Equality Framework and really underpins that. So we'll be progressing on some of the work for that as well. During lunch, we will have the screening of the service user documentary, and then we'll have time for each of the boroughs and divisions to speak on what's happening locally in their areas with regards to health inequalities. And as I touched upon, we'll then have the Dialogue Plus champions coming in to talk about the new care planning tool, Dialogue Plus. And then later on, we'll have a presentation from Black Drive Haringey, again, a voluntary community sector organisation who've been working closely with us and again, doing a lot of work to progress health inequalities, particularly in the Black community. And then to close, we'll be having another screening of a short film called Me, My Father and Mental Health, which was produced by Black Thrive Haringey with the CEO of an organisation called Father to Father. And it really highlights the role of support network around a service user as well, because I think as much as the service user is key, pivotal and vital, their support network is also something that we really do need to make sure gets the right attention focus on. And then after that, 3:30, we then want to allow for networking and people to have the opportunity to speak to services about what's going on. And also we'll be having some VCS colleagues to join us as well to again show that integration of not just our services, but also that we're working together with our wider public partners in supporting our communities in addressing their health inequalities. So yeah, I had sent an email around. I'm having planning meetings coming up, and also it would be great. I think I mentioned this at a previous meeting, but yeah, to have a couple of people from each of the divisions and boroughs to support on the day. So that would be great. So if there's anyone you'd like to nominate or that would be interested on the day in assisting, then yeah, please do get in contact with me, as that will be vital just to ensure things run smoothly. Thank you. Any questions? Oh, sorry, one more thing just to add. Posters will be circulated shortly, but I'll drop in the chat because the Eventbrite link is now live, and so you can sign up and find further information, so I'll drop that in the chat.
Thank you, Jodelle. Great program. I guess there's an action, isn't it, for us as the divisions there to send you the names. So you've already sent us an email, so we need to respond to your email and send you a list of people that might be able to help with the event and the planning for that particular program. Thank you. Jo?
It was just to say, is the invite accessible enough to service users and carers?
Sorry.
I have reviewed this with our comms team. If anybody has gone through the Eventbrite link or does have any concerns, please do let me know, because we can tweak that. But yeah, in terms of the posters, yeah, we've been working with the comms team to make sure that it's accessible for people.
All right, it's just that just to make sure we get out to all the service users and carers and share that.
Yeah. And I've also got my contact details on there as well, so if anybody does want to call me directly, my information will also be there as well.
It does work, Jodelle, because I've done it connected to me.
Thank you. Johnny?
I certainly would love to take part if you would have me, and if I can help out on the day, I'd be more than willing to do so. I've also been involved with Dialogue Plus. We set it up in CNI many years ago, and we did a video. It's on YouTube at the moment, and we're updating that. But I'm also working with your colleagues from Phil Bunny and Haringey on developing Dialogue Plus, etc. So please engage with me if you want me. I'd love to help. So thank you.
Oh, fantastic! Thank you, Johnny. I'll pick up with you outside of this meeting. Thank you.
Thank you, Johnny. Thank you. Right. Jodelle, do you mind just sharing the priorities? So that's the last item on the agenda, and I